Did you know there's a tiny gland in men's bodies that can cause some pretty big problems as we age? It's called the prostate gland, and although it's only about the size of a walnut, its role is very important. The prostate sits just below the bladder, wrapped around the urethra, and its main job is to produce the fluid that mixes with sperm to form semen. Pretty small, but crucial. Now here's the issue. As men get older, the prostate often enlarges. This condition is called Benign Prostatic Hyperplasia, or BPH for short. Benign means it is not cancer and doesn't turn into cancer. But, and this is key, BPH and prostate cancer can still happen at the same time, which is why knowing the symptoms really matters. So let's break it down. Who's at risk, what symptoms to watch for, and why it shouldn't be ignored. Risk factors for BPH. Some men are more likely to develop BPH than others. Risk rises significantly after the age of 50. You're also at higher risk if your father or brother had BPH, you're overweight or obese, you lead a sedentary lifestyle, you have erectile dysfunction, or certain other medical conditions. So while aging is the biggest factor, lifestyle and genetics also play a big role. Common symptoms of BPH. Let's walk through the most important warning signs. Number 1. Frequent urination, especially at night, nocturia. One of the very first signs of BPH is the need to urinate more often than usual, particularly during the night. Many men wake up 2, 3, or even more times to use the bathroom, which disrupts sleep and leaves them tired the next day. This happens because the enlarged prostate presses against the urethra, making it harder for urine to pass. So the bladder becomes more sensitive and contracts more often. Over time, this frequent urination can affect not only sleep quality, but also overall health, leading to fatigue, irritability, and even an increased risk of falls at night in older men who rush to the bathroom in the dark. Number 2. Urgency to urinate. With BPH, the urge to urinate often comes suddenly and strongly. Imagine sitting in a meeting, traveling, or even shopping, and feeling like you need to rush to the restroom right away. This urgency occurs because the bladder is working overtime against the blockage caused by the enlarged prostate. For many men, this can create embarrassment, stress, and anxiety, since delaying urination may cause leaks or accidents. Over time, this symptom can interfere with daily life and reduce confidence in social situations. Number 3. Weak or slow. Urine stream. Another classic sign is when the urine stream becomes weaker or slower than before. Instead of a steady, strong flow, the urine may trickle out or take longer to finish. This happens because the enlarged prostate squeezes the urethra, like stepping on a garden hose. A weak stream can be very frustrating because it often leaves men with the feeling that the bladder hasn't emptied fully, and in severe cases, this can lead to urinary retention where urine stays trapped inside. This increases the risk of bladder infections and even kidney problems if left untreated. Number 4. Interrupted or stop and start urination. Men with BPH may notice that their urine flow starts and stops several times during one bathroom visit. Instead of a smooth stream, it feels like urination comes in short bursts. This stop-and-go pattern is caused by the obstruction in the urethra. It's a clear sign that the bladder muscles are struggling to push urine past the blockage. Interrupted urination can make bathroom trips longer, frustrating, and uncomfortable, sometimes forcing men to strain or push to get the urine out. Number 5. Incomplete. Emptying of the bladder. Many men with BPH describe the feeling that something is left behind after they finish urinating. Despite spending extra time in the bathroom, they still feel their bladder is not fully empty. This incomplete emptying can cause urine to remain in the bladder, which becomes a breeding ground for bacteria. That's why BPH increases the risk of urinary tract infections, UTIs. Over time, this can also stretch or weaken the bladder, making symptoms even worse. Number 6. Post-urination dribbling. Even after finishing urination, small amounts of urine may continue to leak out. A symptom known as dribbling, this can be embarrassing, especially in public, as it can leave stains or odors on clothes. Dribbling happens because the enlarged prostate prevents the urethra from fully emptying, leaving a small amount of urine trapped. For some men, this leakage also irritates the skin and raises the risk of urinary infections. Number 7. Pain or burning during urination. Although less common, some men with BPH experience discomfort, stinging, or burning while passing urine. This can be a result of repeated infections, bladder irritation, or straining to push urine past the blockage. Over time, this symptom can lead to hesitancy about drinking water, since men may avoid fluids to reduce painful trips to the bathroom, which actually makes the problem worse by concentrating the urine. Number 8. Blood in the urine, hematuria. Seeing blood in the urine can be alarming. While it may be due to BPH, it should never be ignored, as it can also signal more serious problems like bladder stones, infections, or even prostate cancer. In BPH, the enlarged prostate can irritate delicate blood vessels in the urinary tract, causing them to rupture and release blood. The color may vary from light pink to dark red. Sometimes the blood is only detectable under a microscope during a urine test, but in more severe cases, it is visible to the naked eye. Any sign of blood in urine should always be checked by a doctor immediately. And finally, while not always talked about, BPH can also affect sexual health. Men may notice problems with erections, reduced sexual satisfaction, or performance issues. Not necessarily because of the prostate itself, but due to the psychological stress and physical strain caused by urinary symptoms. So if you or someone you know is experiencing frequent urination, weak flow, dribbling, or any of the symptoms we discussed, don't ignore it. A simple checkup can help rule out serious issues and get you the right treatment. That's all for today. If this video helped you understand BPH better, give it a thumbs up, share it with friends, and don't forget to subscribe for more health insights. Take care, and see you in the next video.